All right, so we're talking about home accessibility today. So home safety, all the different things to take into consideration when you're looking at aging in place, when you have certain physical limitations to how you can move around the space. We're going to focus, let's specifically focus today on seating for someone with a knee ailment, so maybe a knee replacement. All right, so there are going to be times when we look into dementias, when we look into shoulder stuff, when we look into hip stuff, foot stuff, cognitive issues, visual impairments. But today we're going to focus on the knee. So we're already inside the house. We've assessed the outside stairway, the entryway of the door. Depending on if you have crutches, cane, or walker, you want to think about the width of the door, the width of the steps, the width of the handrails on the front entryway. And I always carry just a little measuring tape with me to every house that I go to assess. So the first thing that I'm going to do when I come in is just look at the space. And so the floor is super clear. Typically when you're looking at rehab from an acute injury in the leg, or you just have a chronic ailment of the leg, you want to make sure that there's not stuff that you could trip over. So throw rugs can be an issue if they're not taped down and there's no like edges showing. You should be good so you don't trip over it. Then we go over here. Again, think about space that you have to move. So if I'm looking at assessing this space, if I have crutches or a walker, I'm probably gonna be able to get through at my size. But if I were a 400-pound elderly gentleman, it might be a little more difficult. The other thing is, when we're taking into account amount of space that we need, it's not always the same range for everybody. So somebody with the visual impairment or somebody with a fear of falling is going to need a lot more space than someone who's very comfortable and who's had a very clean process in their surgery, their rehab. So if you measure the walker and you measure this and it's perfectly fine, also ask questions about what are they seeing? Do they feel safe? Like, what does it feel like? So we got through here, we're good. This probably wouldn't leave here, even though they're super cute. We're not gonna have those right in the walkway for someone with a walker or a knee replacement. And then we're gonna look at the couch. So this is a small space. This is perfectly good for healthy young adults, healthy old adults. When we think about the height of a seating arrangement, however, we want to think about how much bend we have in the knees and hips and how much space there is between the ground and the sitting surface. So if I'm acute knee injury, I'm gonna have a lot of problems bending my knee. So typically you start the measurement from heel to knee, and I got, roughly 50 inches. I would be a lot more specific based on who it is. And then thinking about that, so if I'm going just the length of my lower leg, the tibia from knee to heel, then that gives me something to think about in terms of if I have full bend in my knees, that's the measurement I'm going to use. So if I'm looking at 50, so this couch, a little bit lower than 50, it's about 40 inches high, and this is going to press down, so take that into account too. With my knees, you can see that they clearly bend beyond 90 degrees, so it's not going to be an issue. But if I can bend only to here, and I'm sitting down, come over to the side so you can see that. Look at where my knees get to, and if I have an acute knee injury, I'm probably stopping right here. So this couch is going to be a no-go for knee replacement. It also has a super low armrest. That's another thing to look at. Sometimes you can prop up, give plenty of stuff to increase the height, and that might help. That's one option. Or you can prop up the legs with bolsters to give you 6 to 12 inches off the ground. There's just a couple things to think about.